Hi guys, welcome to my YouTube channel. My name is Aditayo. I'm a registered nurse, and today we are going to be starting a new series on the nursing care plan. So in this video, we're going to be looking at what the nursing care plan is about. We're going to be talking about the purpose of the nursing care plan, the difference between the nursing process and the nursing care plan, the components of the nursing care plan. We're also going to be looking at how a proper nursing care plan should look like. We're also going to be discussing what to expect in subsequent videos.
Are y'all ready for this?
So imagine you have a toy box that has different toys inside it, and each toy has a label of how to play with them, or rather, how to use it. So now take this imagination into nursing. So, nursing care plan is just like a framework that tells you all you need to know about your patient. It gives you an idea into what the patient needs, how to help them, and what to do to help them. Just like a map that gives you a guide on what to do for a patient. So it guides you towards the patient's care. Oftentimes, most people confuse the nursing process to nursing care plan. So they'll be like, oh, what's the difference between nursing process and nursing care plan? The nursing process is like an umbrella term that describes all you are going to do for a patient from the moment the patient steps into the hospital to the point of discharge. So we have five components of the nursing process. We have the assessments, we have the diagnosis, we have the planning, we have the implementation, and then we have the evaluation stage. So it's given an acronym which is ADPI. So assessment, diagnosis, and then implementation and evaluation. So that is nursing process. So the nursing care plan comes in the planning phase. Do you understand? So the nursing care plan is part of the planning phase of the nursing process. It helps you to be able to nurse a patient better, actually helping you to be able to identify their needs and solving them. For instance, if there is a nursing care plan for a patient that is having high temperature, and then you see the care plan, you're like, okay, you understand that, oh, this person was having temperature in the morning. You want to continue the care by checking, has this spike in temperature resolved or not? If not, you want to start all over from the beginning and then try to plan and make another diagnosis and then go forward like that. So it helps you to be able to nurse a patient better, and it helps you to be able to make sure that the needs of the patient are actually being taken into consideration and solved. So the components of the nursing care plan, there are five major components of the nursing care plan, which includes one, the nursing diagnosis, then two, the nursing objective, three, we have scientific rationale, four, we have nursing intervention, and five, we have nursing evaluation. So in your nursing council exam or your council exam can be asked to draft a nursing care plan up for a patient. So you want to put this component in a tabular form, and so just know that these components are the five major components that every patient should have. Now, for the nursing diagnosis, I told you we have five components. So the first component is the nursing diagnosis. So for the nursing diagnosis, we have different types of nursing diagnosis. We use the NANDA list to create a diagnosis for the patient. So the NANDA list is like a list that is being updated as different diagnostic label. So for instance, you can see hyperthermia, you can see risk for infection inside the NANDA list. So they are just like diagnostic labels. The first thing you want to get before drafting a nursing diagnosis for a patient is to get your NANDA list. You need to have familiarized yourself with the NANDA list. So in the NANDA list, I told you have different diagnostic label. So you want to pick one that is specific to that particular patient, and then you want to do this in terms of priority. So if my patient is having high temperature, I pick hyperthermia. So now hyperthermia is the diagnostic label I'm using. We have different types of nursing diagnosis. We have the one that is problem focused, and we have the one that is risk focused. So for the one that is problem focused, so you pick your diagnostic label related to the cause and plus your clinical signs and symptoms. So, for instance, I come into a patient room, the patient is having high temperature. I can say hyperthermia related to what is the cause of the hyperthermia? Infection, evidenced by what can you see? What made you feel like the patient has high temperature? You can say evidence by elevated temperature of 38 degrees Celsius. So that is your nursing diagnosis. So the problem focused nursing diagnosis has a diagnostic label plus your cause, that's which is related to as evidenced by your clinical signs and symptoms. Now, the second type of nursing diagnosis is the risk focused. So that's a type of diagnosis that is dependent on what to expect. So, for instance, a patient is bleeding excessively. You know that this patient is at risk for shock due to this bleeding. So you can say risk for shock evidenced by excessive bleeding. So usually we used to have risk for shock related to, but now it's now risk for shock as evidenced by your clinical symptoms. So the diagnostic label plus your clinical symptoms. I hope you understand. So let me just take you through how the NANDA list looks like. So this is the NANDA list. It is usually updated every 2 years, and then it has different diagnostic labels. So can you see risk for disproportionate growth, which is a diagnostic label. So you can see everyone under different headings. So you can just go pick a particular one that is specific to your need or to the patient need, and then plan your nursing care around that. Stands for North American Nursing Diagnosis Association. It's a standardized document that contains different diagnostic label and is used by nurses worldwide, where we have different diagnostic label that communicates patient needs. For instance, you won't hear other healthcare professionals talking about hypothermia related to evidence by they don't understand. So it's a language that is common to us to communicate what the patient needs. What is your nursing objective? Your nursing objective is aim for that patient. So, for instance, I already made a diagnosis that this patient is having fever. Now, what do I want to see in maybe the next 2 hours? What do I want to see in the next 30 minutes? What do I want to see in the next 15 minutes? Now, for a patient having hyperthermia, it is said that between 15 to 30 minutes, at least there should be a transient change in the temperature before the major cause has been addressed. So, a patient with hyperthermia, you can say that your objective is to see the patient's body temperature reduced by lysis in 10 to 15 minutes or in 15 to 20 minutes. So that is your objective. Your objective has to be SMART. So meaning that it has to be specific, measurable, achievable, realistic, and time bound, meaning that there should be a time frame. You can't say hyperthermia should reduce throughout the period of hospitalization. Why? Because it is not time bound. It is not specific. You're saying that you don't know. So for every time you're making a nursing diagnosis and you're giving an objective, you want to make sure that the objective has a time frame. There are some times that we might come across some diagnosis and you're like, wow, this there is no time frame for this. You can actually give a time frame for this. So let me give an example. For instance, you're giving a diagnosis of risk for infection. So risk for infection as evidenced by immunosuppression. Let's use that. So now you can't say that these patients would not have would not develop infection throughout hospitalization. You have to be, so you can say between 24 to 48 hours. Then when you come back and say that okay, this patient did not develop this, you want to start all over from the beginning again and still give it another time frame. So you don't say throughout, you want to be specific to a particular time. Follow the SMART principle when making your nursing objective. Is NANDA lists used worldwide to communicate patient lists? At the moment, I am not certain if it is used worldwide, but I know it is basically drafted to be used worldwide. I have come across some people talk about how that they only use the NANDA list for specialist care. while nursing theories are being used to draft a care plan for patients in some other countries. For instance, they can for instance, let's say the Dorothy Orium's theory, they can use it to draft a care plan for a patient and not necessarily land a list. But whichever way, the basic thing is that the patient's needs are being considered. So thank you for watching this video. In subsequent videos, I'm going to be going deep into what the nursing care plan is about. We're going to be taking conditions, different conditions, and making their nursing care plan accordingly. Thank you.